Thank you very much, Mr. President, Mr. Vice President.
Dr. Anthony Fauci has been a public face in the fight against COVID-19 in the U.S., pushing science over politics at the White House and elsewhere.
I have never made myself out to be the end-all and only voice in this.
He's a key member of President Trump's coronavirus task force and unafraid to contradict him, fueling speculation around his firing.
I'm not firing him. I think he's a wonderful guy.
In May, Dr. Fauci was possibly exposed to the virus. He quarantined as a precaution and seems to have kept a lower profile ever since. This as the U.S. moves forward with its reopening, despite his earlier warnings to move slowly. I asked Dr. Fauci about that and how the U.S. has handled the crisis. Dr. Fauci, thank you so much for making the time.
Good to be with you.
I want to talk a little bit about the reopening process in the United States, because over the past week or so, we have seen some increases in cases in places like Texas, California, Oregon. Does that tell you that the reopening is happening too quickly? What are your concerns around that?
Whenever you start to reopen or get to some degree of what we call normality, there will be increase in cases. The interesting and important thing is to identify, isolate, and contact trace so that you can blunt those little blips and prevent them from becoming true rebounds of infection. That's what we have to see, because you're right. We are seeing the appearance of additional infections, particularly in the areas that are opening. Mm-hmm. If we handle them well, we could be okay. If not, then we really have a significant problem.
The U.S. has had a mortality rate that's about 60% higher than Canada's. It's had twice the number of cases per capita. Why do you think that there has been that vast difference?
You know, that's a good question. We don't really know the difference, the reason for that difference. It could possibly be, I mean, if you look at what dictates morbidity and mortality, we have a particular vulnerability among individuals who do have these comorbidities of hypertension, of obesity, of a variety of other underlying conditions. We also have vulnerability among our African American population. Yes. It is entirely conceivable that the disparity in the relative proportions demographically of African Americans and other minorities would make our mortality rate higher. I don't know that as a fact, but I think that's something we should at least consider.
The border between Canada and the U.S., as you know, was shut down to non-essential travel towards the end of March.
Travelers will no longer be permitted to cross the border for recreation and tourism.
We don't want people coming into contact, because that's the way we're going to win this war. That is so important.
Can I ask you what you think should be the criteria for reopening the border between our two countries? What would you like to see in place on both sides in order to make that reopening safe?
I am not an expert on closing and opening borders. What you would like to see under any circumstances would be to see a significant diminution consistently in the number of cases, hospitalizations, and obviously deaths. But I think what you mentioned about some states now having an increase in the number of cases makes one pause and be a little bit concerned. But I don't want to extrapolate that to making any statements about border closing.
That's fair. What is the message to the world about how the United States is doing, or how concerned should the world be given how this unfolded there?
Well, I'm not so sure the world should be concerned. The United States has gone through a very, very difficult situation. I mean, you know the numbers. Yes. We have millions of cases, and we have now 112,000 deaths. That is the most of any country. That is something that is obviously very serious that we're trying to deal with. I think that's more of a concern for us than it is for a concern for the rest of the world.
In Canada, there is a real deference from politicians to public health officials and scientists in the way they are, asked to answer a lot of questions around the pandemic. How does that kind of deference help the population trust information?
Well, when you hear from health officials whose job is the safety and health of the nation, then you have confidence that what you're hearing is something that is worth following, which is the reason why I'm on television here talking to you, that I do the same thing with outlets in the United States to try and get the accurate information to the general public.
Has that been challenging for you, given the administration?
No, actually not, because I have been able to freely go out and talk about evidence-based facts. And I've had no interference in my doing that.
Let me ask you a little bit about the WHO, if you don't mind. Obviously, it's been there've been lots of questions in all countries, in this country as well. But the president in your country has said that he intends for the U.S. to leave the WHO.
Redirecting those funds to other worldwide and deserving, urgent global public health needs.
Are you worried about the consequences of that decision?
Well, I mean, I've been dealing with the WHO now for 4 decades. The WHO is an imperfect organization. It certainly has made some missteps, but it has also done a lot of good. The world needs a WHO. I would hope that we would continue to benefit from what the WHO can do at the same time that they continue to improve themselves.
But if the U.S. is withdrawing and has suspended all funding as the biggest funder, are you concerned about the future of the WHO as someone that has leaned on it and found it helpful in the past?
No, like I said, and I'll repeat, the world does need a WHO, as imperfect as it is, but we would hope that as it goes forward, it would continue to improve and try to essentially correct some of the missteps of the past.
Can we talk about vaccines a little bit? Because there are more than 100 or so vaccines that are in development now, as well as various treatments. We have heard maybe by the end of the year. What is your assessment on how close we are to that right now?
We will be going into a phase 3 trial for efficacy, which is a large trial of about 30,000 individuals, which if we're successful, and I have to underline if, because whenever you're dealing with the development of a vaccine, nothing is ever guaranteed. But we're cautiously optimistic that at the end of the year, the beginning of 2021, we could have a vaccine that could be ready to deploy to the public.
At this stage, do you think a second wave is inevitable? We know the most pandemics do have one, but is it inevitable? Will we be able to contain it?
I don't think it's inevitable. I think we will, as we get into the fall and winter, see additional cases. If we handle them properly and efficiently, I believe it is not inevitable that we will have a second wave, as it were. But it could happen if we don't handle the cases that will inevitably appear. What is not inevitable is that it will turn into a second wave.
You do sound more hopeful than I would have expected, though.
Well, I'm cautiously optimistic about the interventions that we're going to be able to implement. I believe that if we get a vaccine and we implement the public health measures to the best of our ability, that we'll get over this. This is a terrible ordeal we're going through, but it will end and we will get over it.
Dr. Fauci, thank you so much for making the time for this country. We do appreciate it, sir.
My pleasure. It's good to be with you. Thank you for having me.